lumbar spine visible. And then she's going to do a forward bend in sitting. So it's going to say bend down, touch your toes if you can, and just look at that whole gross movement. So here now you can see her midline is actually there and the scar's just moved a tiny bit that way, although if you're not standing, sitting right behind her, you can't see. So you're there and you feel a bit of tension there. We're going to go, you said you felt it in both sides, so we're going to go in around here. What did you actually have done?
Dyslexia and fusion, L4-5.
And back up again. And when they say fusion of the lumbar spine, metalwork?
Metalwork.
So we want to know whether there's any chance of getting movement out of those segments. But it doesn't mean you can't snag it, because the snag's not tissue specific to the facet joint and the spinal segment. So just try it anyway, basically. Like she feels it. Back to legs?
Yeah.
So 4 or 5 is kind of where I'm going to be thinking. Some interesting lumps of bone around here. Right, so I reckon I'm about 5, but I don't really care. And then you're going to bend forward again. And she's going to bend just until I feel like she gets kind of halfway down. So stick your elbows on your knees for me, so that just works nicely. So she stops here, and just before she gets to any kind of problem, what I'm going to do is I'm going to add 2 thumbs either side of the spinous process. I'm going to scoop up to stretch the space between the spinous process of the one I'm shoving on and the one below, maybe. Or just lift the skin around that segment. I get under the vertebrae and I lift the spinous process, and then you're going to go down as far as you can comfortably go there. And back up. Does it feel better, worse, or the same?
Well, I don't feel anything while I'm sitting.
Yeah, fine. So just tell me whether you notice any increase in range of motion. God, the tone round there. So forward again, so she has to bend forward to take away the tone. It's particularly important on this particular back, that we kind of do that bit first. And then I'm going to shove this next level up, and I'm just going to try that, and then you're going to drop down into flexion again. That's better. And then back up again. So I should have thought that inside my head, not said it. Try not to lead the patient. So where possible, let them suggest the level. Go one more time there. So this is a sitting lumbar flexion snag, and it's a good technique. Have a stand up. Show us one forward bend just to see if we're getting anywhere. A little bit.
Yes, a little bit.
Can you kneel on the bed for me with your head at that end? High kneel and hands on here, so not high kneel. Move your feet a bit further back. So now from here, she's just going to sit back bum to heels, and we're going to see what range she gets here, right? So this is horizontal deep squat, basically, and then back upright again. So I said sitting was a good technique because I think 4 points a great technique, okay? So this time, rather than using my thumbs, I'm going to use my pisiform as my contact point, and advisedly, we're going to hold round the middle here, okay? But tell people what you're doing before you do it, and like that. We said we reckoned 4 was our level, so I'm going to just hold the pelvis like this, and then I'm going to put pisiform in the spinous process for 4 or 5, stretch the skin a little, and then she's going to sit back bum to heels there. And back to upright. Just do 1 there, maybe 1 at the level above. So here, and go again. And this going midline on somebody with a scar makes lots of sense, right? If she had really bad pain on one side, then I would move my pressure to that side. But the spinous process is like a little lever to jack the segment open, and so even for unilateral problems, you okay?
Yeah.
Central is a good bet, because you get more force than if you do this. This is undoubtedly more of a fascial technique. This has half a chance of being vaguely articulate.